Thank you all for joining me today in this presentation about monitoring and evaluating the impact of a research partnership project on the needs of Canadians with disabilities during and after the COVID-19 pandemic, the COVID-19 Disability Survey. My name is Femke Hoekstra, and I am a postdoctoral researcher at the University of British Columbia in Canada. I would like to begin by acknowledging that the land that I reside on is unceded territory of the Syilx Okanagan people. As you may know, research findings are not or very slow translated to community and policy settings, and the estimated 70 to 20-year gap between discovery and implementation is of course unacceptable during a pandemic. A promising approach, however, to bridge this knowledge translation gap is to do research in partnership. And these research partnerships, in which researchers and research users work together to do and disseminate their research, have the potential to accelerate and improve knowledge translation processes. The COVID-19 Disability Survey is an example of such a research partnership project. The COVID Disability Survey is led by the Ability Center in partnership with CDPP researchers from the University of British Columbia and the Queen's University in consultation with various community organizations. The Ability Center is a charitable organization committed to enhancing quality of life, social isolation, and health and well-being for people of all ages, abilities, and backgrounds. The CDPP, which stands for the Canadian Disability Participation Project, is a nationwide network of researchers and community partners working together to enhance community participation among Canadians with disabilities. The COVID-19 Disability Survey is an initiative to record the experiences, concerns, and needs of people with disabilities during the COVID-19 outbreak and recovery periods. The survey was created with the idea that these findings will provide important information to help communities ensure that COVID-19 response strategies meet the needs of people of all abilities. And as such, to make sure that survey findings can help communities and can make impact in the society, a fast and effective knowledge translation process is needed. And the aim of this study is to monitor and evaluate the impact of a research partnership, focusing on the needs of the Canadians with disabilities during and after the COVID-19 pandemic. So the COVID-19 Disability Survey is available through disabilitysurvey.ca. And what is unique about this survey is our focus on enhancing accessibility and inclusivity. So to illustrate, the survey is available in English, French, plain language, and American Sign Language. So this slide provides an overview of the project. And at the start of the pandemic, in April and May last year, we focused on establishing the partnership and preparing the survey. The boxes in green below the timeline indicates when we relaunched different versions of the survey, which allows us to track changes over time in terms of people's needs, concerns, and experiences. The boxes in blue above the timeline shows when we have shared key findings of the survey through various open access reports, which I will tell you more about later on in this presentation. The survey is being promoted via social media as well as through the network and connections of our partner organizations. Survey findings are being disseminated through open access reports, which are also available in different versions and accessible formats, including plain language and American Sign Language. The monitor and evaluation of the uptake of the survey findings is part of a larger multiple case study that aims to evaluate and explain the outcomes and impacts of the CDPP network in order to gain a better understanding of how, when, and why research partnerships are successful or not. And the components of the RE-AIM framework, including the reach, effectiveness, adoption, implementation, and maintenance, are used to guide our evaluation projects. For those who are interested, we published a protocol paper of this larger study in Health Research Policy and Systems. So when we look at the reach of the COVID disability survey in terms of number of people who completed the survey, we have 713 participants who completed the survey between June and December of last year. And so far, we have 443 participants who completed the survey between December and April of this year. So of the 713 participants who completed the first version of the survey, 84% identified as a person with a disability, including people with different types of disabilities, as listed on this slide. 21% of the participants identified as a parent or caregiver of a child with a disability, and 23% identified as a person with a family member or roommate with a disability. The average age is 49 years old and ranged between 18 and 91 years. So far, the promotion and dissemination activities included the publication of 4 open access reports outlining survey findings, over 60 social media posts from ability centers, promoting the survey and highlighting some key findings, 2 press releases, and findings have been shared through 7 government and community presentations. These are the 2 press releases. So the first one was in September last year to promote the survey, and the second one in June of this year to share some of our key findings. So far, the survey findings have resulted in some important positive policy changes. So to illustrate, in the beginning of this year, the Ontario government changed their policy to provide people with disability access to physical therapy programs. And this change was informed by the results of our COVID disability survey, in which we found that the pandemic has a negative impact on lifestyle behaviors of Canadians with disabilities, including their physical activity levels. We also published a report on vaccination willingness among people with disabilities. And these findings provided guidance on how to ensure vaccination sites are fully accessible for people with disabilities. So in terms of next steps, we are currently preparing the next version of our survey, which we will launch at the end of this month, and will also include questions around COVID-19 recovery and reopening plans. We will share data from our survey with people with lived experience, government, organizations, and general public. We are also working on broadening the reach across communities that currently have low representation. We will continue to monitor and evaluate the impact of the COVID-19 disability survey, And if you want to keep updated about the project, you can visit our website or follow us on Twitter. So in summary, this study illustrates a unique research partnership initiative in which real-time information is being collected and disseminated in an inclusive and accessible manner to help support communities and governments ensure that COVID-19 response strategies meet the needs of people of all abilities. And with that, I would like to thank you all for listening. And I would like to acknowledge all members that are part of the COVID-19 disability survey team, which are listed on this slide. And I'm happy to take any questions.